In this lecture, we will be discussing the sport of tennis and the key science-based issues in this sport. First, we will start by listing 6 of the most relevant science-based issues involving tennis, so let's get started. Number 1. Coaches are unaware of the importance of a sport-specific flexibility program and its effect on increased performance and decreased risk of injury. Number 2. Elite tennis athletes experience more chronic overuse injuries than youth or average players, and the most common are overload of the shoulder or tennis elbow. In fact, over 50% of the world's top tennis players experience some type of shoulder problems in their career. Number 3. Physical growth and maturation has a large impact on positive and negative physical adaptations to performance as players age, and must be monitored closely during pubescent years. Number 4. The work-rest ratio in training is extremely important in tennis in regards to coordination and reaction time, as fatigue interferes with proprioceptive ability. Ratio should be between 1:3 and 1:5. Number 5. Coaches are unfamiliar with the need for balanced strength training between the upper and lower extremities. Most tennis injuries are seen in lower extremities, and more focus on lower body strength can be a preventative measure against injury. Lastly, number 6. It is important for tennis players to have high VO2 max levels, usually approximately 44 to 55, to perform well due to the highly anaerobic nature of the sport. However, it is important that coaches aerobically train athletes as well due to the longevity of matches. Now that I have familiarized you with some of the important issues coaches need to be aware of, we will go into further detail regarding issue number 1, the importance of a sport-specific flexibility program in tennis training. Often in training, flexibility can be a motor performance ability that is overlooked. In the sport of tennis, science literature has deemed flexibility as a key training component to not only improve a player's performance, but to also prevent common injury, including injury due to overload. Due to the nature and demand of the sport, players develop musculoskeletal adaptations and have significant differences in flexibility in comparison to athletes in other sports. These adaptations can also cause muscle imbalances as more strain is placed on the dominant arm. A study out of the Lexington Clinic Sports Medicine Center tested the flexibility differences of elite tennis players in comparison to other athletes. You can see on the tables below, they were able to conclude that the tennis players had significantly increased internal rotation in their dominant arm and suggested that there should be a focus on external rotation in order to maintain strength balance and reduce the risk of overload injury. This is a diagram from another study that compares the trunk flexibility of 4 types of trained athletes in comparison to average flexibility of an individual. The results for the males are on top and females are on the bottom, and the arrows signify the line for the tennis players. And as you can notice, their trunk flexibility is significantly lower than that of other athletes, as well as the average person. It is also important to acknowledge the age of the athlete. It is important to note that younger athletes are naturally more flexible, so it's imperative that you track the adaptations that are taking place as the athlete grows and matures. One must realize that these losses in flexibility start at an acute level in youth tennis players and progress, becoming chronic maladaptations in elite athletes. And here is just a review of when flexibility is at its peak in an athlete. And here you can notice that flexibility is at the same peak age for both male and females. Here is just another diagram to kind of refresh the memory as to when flexibility starts to decline. Now, tennis is a sport that encompasses several short-duration, explosive, and powerful movements at high velocities. These movements cause repetitive shortening of the muscle that results in microtraumas due to the constant tightening stress that is placed on the muscle. As microtraumas continue to occur followed by scar formation, the cycle eventually creates maladaptations, which in return limit the flexibility and range of motion that is crucial to performance. If an athlete continues to perform with insufficient flexibility, it will lead to increased muscular weakness and mechanical instability. Let's take a look at how this happens in the upper extremities as well as the lower extremities. In the upper extremities, tennis athletes generally have a greater internal range of motion in the shoulder via the glenohumeral joint of their dominant arm. This increase can be attributed to the continual use of the dominant arm in service and return of the ball. However, this repetitive motion creates an imbalance in the range of motion in the shoulder, significantly altering the external range of motion, which increases a risk of overloading. For example, shoulder overload injuries are common in tennis players due to the repetitive stress incurred when serving. External rotators can become fatigued, leading to superior or anterior glenohumeral translation due to larger muscles overpowering action that takes place. And in this diagram, you can see a potential overload injury of the rotator cuff. Now, in the lower extremities, injuries are 2 times as common as upper extremity injuries, according to science literature. The literature has also substantiated evidence for the correlation between decreased flexibility and range of motion in the lower trunk and hamstrings, and higher risk of lower extremity injury. Tennis players must remain low with knees slightly bent in preparation to quickly change directions in order to accurately return the ball to the other side. In this position, muscles remain extremely tight, and often hamstrings and the lower back are contracted for long periods of time in order to allow the athlete to perform explosive movement patterns. Minimal extension or lengthening of the muscles during a match increases risk of muscle tears, stress, or strains. And presented here, you can see some of the positions as discussed. For these reasons, a sport-specific flexibility program is important to ensure that flexibility and range of motion are sufficient. A coach needs to closely monitor range of motion in tennis athletes, as flexibility varies among athletes, and flexibility programs should be individualized for optimal results and to prevent excessive overtraining, which could alternately lead to negative implications. Now we'll briefly discuss some simple flexibility tests that can be done to assess your athletes. We'll first look at the upper body. We'll have some assessments for the shoulder and the scapula, flexibility and range of motion, and then we'll move towards the lower body where we will assess spine and trunk flexibility, the lower back, as well as the hamstrings. This first test assesses the flexibility and range of motion of the shoulders. Have your athletes stand with arms bent and in line with their shoulders. Have them try and push their elbows back behind their shoulders as far as possible. By measuring the distance the elbows go behind the shoulders is how the range of motion is measured. This next test, it also assesses flexibility of shoulders, but also the scapula. Have your athlete lay on the ground in a Superman pose and try to lift arms as high above their head as they possibly can. The way to assess this range of motion is via the angle that's made between the arms and the spine. One last test that can be used for the flexibility of the shoulders and scapula is the hands behind your back test. Have your athlete try and touch both hands behind their back. Level of flexibility can be measured by the following: excellent if fingers overlap, good if fingers touch, average if fingers are less than 2 inches apart, and poor if fingers are greater than 2 inches apart. Now we'll take a look at some of the assessments that can be used for lower body flexibility. The following tests can be used to assess the flexibility in the trunk and spine. Have your athlete lay on their back and rotate hips and legs to one side while trying to keep both shoulders on the floor. If the athlete cannot keep their shoulder in contact with the floor, they are lacking the adequate spinal range of motion. The last test is a sit and reach test, which is a simple way to measure an athlete's lower back and hamstring flexibility. And here in these pictures, you can see a couple athletes performing the sit and reach. As you can see from the picture on the right, it is easy to make your own if you do not have access to an official sit and reach box. Here we just have a table of normative values based on percentile for both male and females of various age groups for the sit and reach, so that you can gauge the flexibility of your athlete and note lower body deficits based off of their results. You should now know the reasons as to why assessment of flexibility in tennis athletes is so important to their performance and why it's necessary to implement it into training. Neglect to this training aspect is a key science issue that can lead to biomechanical deficits in your athletes. However, by implementing flexibility and stretching into training, improvement can be seen in 2 to 4 weeks, and correction can be attained in 6 to 8 weeks. I hope that this lecture has brought a key science-based issue to your attention and has given a better understanding of the mechanics involved with tennis. In conclusion, we will just review some of the main takeaways from this lecture. Key point number 1. Flexibility is one of the most important motor performance abilities in training for tennis players. Point number 2. Tennis players tend to develop more deficiency in flexibility than any other athletes, especially in the shoulders and the trunk. Point number 3. Tracking athletes' maturation is key in catching negative adaptations. And lastly, point number 4, there are various methods that can be used to assess one's range of motion. And remember, we just discussed a couple of them, such as the reach behind the back, the sit and reach, the Superman, and a couple of others. And these are great ways to assess the range of motion of your athlete. With that, I hope that you enjoyed this lecture, and feel free to reference any of the sources that were cited to create this lecture.